Well, good afternoon, CAPPO. Thank you for joining today. Hopefully we're going to make the next hour very beneficial for you. What I'd like to do is, before we start, I'm going to give Michael Derr, our president, a moment to say some introductory remarks. And first of all, I want to thank our panel, both the moderator that's going to be moderating your questions for us, Craig Rader. Thank you, Craig. Scott, who's our director south. Jennifer is going to be joining us a little bit later, and John, thank you for joining us to give us a perspective from a district, water district. And myself, Mike and I will represent a couple counties' perspective here. So a little bit just about, if you're not that familiar with using this technology, it should be pretty self-explaining when you put, there should be a little dialog box over to the right that you can adjust those panels. And probably the most important thing is that you, I think Sheila can mute you and unmute you if we start to have any discussions. But you can use the chat feature to get some questions in. And then really what we're going to try to do is if you keep yourself muted, that'll avoid any crosstalk as we go forward. Our format is going to be, we just have a handful of charts of topics. And then what we're going to do is each of the panelists will take a couple minutes to talk about their thoughts on those topics. And then at the end of each of those segments, if you will, topics, we'll open it up for questions, and that's where Craig will moderate for us. So Sheila, did I miss anything there?
No, you got all the key points.
Okay. So I'd like to turn it over to our president, Michael Derr. A few words for start.
Thank you, Jack, and I do appreciate you putting this together, and Craig Rader for moderating this, and for everybody's time on the panel. Thank you so much. I know we're all going through some very challenging times right now, some very uncharted waters for all of us as procurement professionals. And if most of you are like me, you are sitting in your emergency operations center, filling a position within the EOC, most likely within logistics. I just want to thank everybody for your time. I know how busy everyone is, and just want to let you all know that as the CAPPO leadership, we are here for you. We are continuing to do CAPPO business and move forward as normal as we can in these trying times. And we just want you all to know that we are thinking about all of you and hoping that all of you stay safe and are protected through this time. And together, as a CAPPO family and as a profession, we will get through this. And this will definitely show the importance of procurement in our organizations in these trying times. So again, thank you for the facilitator, the moderator, and all the panelists today. Back to you, Jack.
Okay, thank you. So let's get into the first topic. Sheila, if you could put our slide here. The first topic we wanted to kind of talk about is how is procurement engaged in connecting to our sources of supply. Like Mike said, many of us are, for our role, for example, in our emergency operations center, I am the chief of logistics. So my role is more than just purchasing the supplies and services we need. It's kind of the full life cycle, helping some of my responders figure out what they need and how to get it to them, and then how to deliver those supplies throughout our very large geographic region here in San Diego. So we actually have a picture. So I'm in my office, the nice quiet office right now, but the picture you see there is a picture of the Operations Center, which is my other home away from home. And like all of us, we're probably spending I'll let me pass it on to Mike, and Mike, will make any comments about the first 3 bullets here?
No, I would agree with you. You know, as procurement, our role changes quite drastically. You know, we become logistics section chiefs within our EOC. A little different here in Monterey County. We are also the boots on the ground for all of our alternate care sites that we're setting up. So I have logistics support people at every site that we're setting up. So we're at a direct connect with that, as well as we have a medical branch logistics that's under my purview as the chief. So a little bit more added on to us here in Monterey County because we're smaller and we don't have quite the resources you do there in San Diego, Jack.
How about moving on to, if you would, Scott, you want to talk a little bit from a city point of view? I know you guys are connected to our EOC as part of the logistics arm.
Correct. So we haven't opened the City of La Mesa's EOC hasn't been opened full scale. So I think that it has been used a little bit by fire, but which is where it's located. But we didn't completely open it, so it didn't trigger that for me. So for me, and I don't know if that's the same for most smaller cities and agencies, but you know, we're kind of still. My job hasn't changed a whole lot. It's more just the things that I'm doing right now. I'm still doing, you know, purchasing like I was before. I'm just, you know, changed my focus to try to make sure that, you know, we've got the right information to the departments. But yeah, that's it. I don't know if any other, John or anybody else, you know, if you, John, you're with the Water Agency, but Jennifer is on the call. I don't know if they open their EOC.
Jennifer, have you joined us?
Yes, I'm here. Hi.
Hi, welcome. Thank you.
Thank you. So, yeah, we're very similar. We've partnered with the county EOC. We do have a small city EOC in City Hall now. I am not located in the EOC, but I am working with our assistant CFO who is there representing the finance arm as well as the procurement arm. So we are because we are decentralized in most of our day-to-day activity. For this instance that we are in now, we are working together through creating a more centralized approach so that way we can track and monitor all of the related activity to this event. I do have to apologize. I did just get pulled for an EOC need regarding this event, so as much as I want to participate, I have to step away. My apologies.
Well, Jennifer, I you know, we understand, and thank you for everything you're doing for the city of Stockton. So go forward and do great things for procurement.
Thank you so much.
Okay. So John, from Metropolitan Water District, any thoughts here?
Absolutely. Good morning, or should I say good afternoon, everyone. You know, this is a very dynamic situation, and as has been mentioned, our roles in procurement have really taken on key elements of emergency operations. So I too am operating as the EOC Logistics Section Chief. And wearing a dual hat as also providing the information for supply chain and procurement. But what I find interesting when we do have these emergency operations, and for Metropolitan, to give a little bit of a background, so Metropolitan provides water to 19 million people in Southern California, spanning a number of the agencies that are probably on the phone, from San Diego and then as far north as Ventura, and all the way out to San Bernardino, Riverside counties as well. But with that, our role as logistics section chiefs, we find ourselves not only working with procurement, equipment, services, and supplies, but also developing and disseminating effective communication, working with staffing. So when it comes to logistics, it's everything under that umbrella, from your human resources, IT, It's interesting enough, Metropolitan Water actually has their EOC activated in a virtual capacity. So we're not actually meeting in a typical setting. And it's been a great training ground for all of us. So we've procured and issued over 200 laptops, and we have over 800 employees working remotely right now. And then from a staff that's typically around 1,700, on the operations side, that's 1,700 is district-wide, but for operations, they've developed what we have deemed micro teams. And these micro teams are continuing to work on critical essential functions throughout the district to make sure that the water continues to flow, that it's treated. We have a water quality lab, a number of different operations. So for logistics, it's really become very dynamic. And I would just say that there's three words that have really come together, maybe a phrase with that. And first of all, it's expect the unexpected, but communication and collaboration are two key elements of success during these situations. So I think that's kind of an overview. I'd be happy to talk about the connecting sources. Do you want to move into those, or?
Yeah, why don't we do this? I think summarize. I think we all share the same thoughts, and maybe we can start with Mike. I know, John, you talked to me probably 2 weeks ago when this first started to walk out, and it's really about those personal connections and each of us staying connected, so we can, do the right due diligence, share the sources that are coming through for us, because I've been working with Orange County a little bit. My neighbor, my equal-sized neighbor to the north, and even LA, who's my big brother to the north. They said an interesting statistic that they've been only 5% of the people that have been saying, hey, we can sell you PPE, or we could do, only about 5% of them have been legitimate offers. And so that's where our personal relationships, and frankly, that's where CAPPO makes a huge difference among us all. So, Mike, do you want to say anything about either of those last two? We'll go real quick for these last two sub-points, and then we'll maybe take some questions. Greg.
Sure. I would agree too. Checking supplier vendor offers, doing our due diligence. We've gone now to a 3-step process to confirm the legitimacy of those that have come forward and say, hey, I have masks to sell you, hey, I got shields to sell you. We're now having to go through a 3-step process to confirm and verify that they are legit, which is time consuming. So yes, those personal relationships that we've created over the years through CAPPO, with our vendor communities, with our partners that come year after year to our expo show, those are important partnerships. That's where I see that paying off, and doing our due diligence and visiting those vendors at our expo show. You make those connections. Those connections are now paying off for me as I'm searching out services and supplies, as well as connecting with, like yourself, Jack. I've connected with you and other peers. Those levels of partnership and sharing of information is so important, especially in this time right now that we find ourselves in.
Great. Let's see, Scott and John, any other thoughts on those last two bullets there?
I'll let you go first, Scott.
I'm sorry? Okay. I've, again, being a small agency, we're not having to make a lot of those massive purchases. So I have, for the most part, I've just been ignoring all those emails. I mean, I'm getting them multiple times a day, and they all look like they're from the same exact thing. They all have this list of all these things that they're promising. But at this point, we're pretty much, able to kind of keep things close. We've been working, again, like you're talking about relationships, so we've been working with local vendors. In the case of, with sanitary supplies. Our normal vendor was shorthanded, but then a restaurant supply company contacted us, and it's one of those legit. We've used that vendor before, so it wasn't. We might not have thought about that, but that was kind of one of those where it was a blessing because they reached out to us, but we knew they were legit. But all those other little ones that I've been getting, yeah, I've just been going into my junk mail.
Yeah, and you make a good point about using local smaller businesses. I mean, we all have small business policies, expectations there, but now's the time where we can really help them help us. So, John, any last thoughts before we take some questions?
Absolutely, a few. One of the things, and I made this a note throughout to bring up, is that when we have these situations and time is of the essence and we start to acquire information from our colleagues at work when they're handling their critical needs, that's when we will really want to rely on our professional training and make sure that we take the time to vet the process. I think I've heard that once already, but we wouldn't want to throw caution to the wind and should never outweigh moving quickly as opposed to the vetting process. And I think we'll touch on that in a couple areas today, but to share with the CAPPO group, your network is key to meeting these challenges during this time. And an example of that is before coming to the public side, I spent 15 years in retail. And in this situation, I reconnected with a sales group that I hadn't touched base with in over 20 years. But in terms of building that relationship from that point forward, we were able to connect with masks. And I could trust that source because I had used them in the past. Another thing in terms of checking with suppliers and so forth is you're getting a lot of information. If it's anything like what I'm saying, your neighbors are sharing information, your colleagues are sharing information. And so in a prolonged event like this, make sure you circle back with your suppliers, and as you start to develop those lists, maybe put them off to the side, whether it's on a board or let your colleagues know, your teammates know, hey, we've vetted this supplier, they have product, let's continue to circle back with them. And Jack, you're right, we had a conversation, I think at 6:30 in the morning or somewhere around there, and I owe a phone call back to Mike there. We started the conversation, and I think I still owe him a phone call, so you definitely want to follow up with your colleagues as well.
Good. So with that, why don't we move some questions? Craig, do you have anything queued up for us?
Yes, we do. We have a couple questions that have been asked, and a lot of people are asking the same question, and this one's towards Mike. They want to know if Mike can provide his 3-step process.
Yes, I can. I'll be happy to share that.
Okay. And the next question is, starts off with a statement that says, my role in the EOC is support staff to the logistics chief. I'm finding that I'm spending the majority of my time trying to ensure FEMA contract compliance after services have started. Has anyone developed a checklist or cheat sheet for logistics support staff?
Let's see, we do have our checklist, and I would be happy to share that with you. I think all of those are operating under emergency authority by our boards. So at this point, we're fundamentally still doing our due diligence, as was mentioned, and we're documenting, we're benchmarking everything we do, but we are moving much quicker. And what we're doing is we've gone back to the board a couple times because we have to go back to our board of supervisors to extend the emergency authority, and they have granted us emergency authority to do whatever necessary to support the COVID emergency. And then at the follow-up board meeting, they do a ratification. They actually ratify any actions that either myself or the CAO may have. They ratify the actions that the Director of Purchasing and Contracting and my staff, and also the CAO and the DACAO have done in order to effectively respond. So with kind of, we still are paying attention because post-event here, for allowability, as you know, there's billions of dollars that are going to be flowing to us, and that documentation is going to be critical. So I can share that. I will share that checklist that we use here. And you may have to adapt it because we're probably more detailed than most, but I would say scale it for your needs.
And just to tag on what Jack mentioned, we use our Web EOC mission resource tracking as kind of our checklist for task assignments that have to do with contract compliance. So when an item is assigned to a unit leader or a support person within logistics, it's done within Web EOC, and there's a tracker, and we just update that mission task as we go so that we have an ongoing record of compliance. And you're able to print out reports from Web EOC as well for FEMA.
So last comment I'll make regarding that is often I find that my staff, not just me, but my staff that are supporting other branches of our EOC, we have to do the documentation for them because they're focused on the implementation of whatever we're trying to get delivered or services in place. So we're kind of there doing the paperwork right next to them or right behind them, if you will.
I would add, with regard to FEMA reimbursement, it's never too soon to start auditing your process. And again, bring in as many resources as you can that you believe will be valuable in that audit process. Again, normal EOC operations, you'll have your logistics, you'll have your finance and admin, and there are specific staff that are assigned those tasks, but we too use Web EOC, and then behind the scenes, we're making sure that we're following FEMA guidelines, and so we have additional people that aren't as close to the process that are coming in behind us to make sure that we are doing what we believe we're doing and that we're capturing that information. And I would say key to this in terms of past practice and today, make sure that you have project numbers assigned specific to this event. It's very critical. Again, internally, I'm sure that if you're like Metropolitan, those project numbers typically come from finance in these situations, and make sure that that information is shared throughout the organization, and especially with those that are directly involved with EOC operations, because it makes it much easier when you go back and review your process to make sure everyone uses the same tracking numbers.
Good point, John. Your best friend in the EOC should be your finance officer, and that's exactly what's happened. They get a copy of everything I buy, every purchase order I buy. They're then kind of getting it into their reimbursement.
And just to tag into that, one of the things we're doing for everything for this COVID-19 incident, everything starts off with COVID-19. Every PO, every project, everything we do so that we can go back later and run a report, whether it's in Web EOC, whether it's in our financial system, our procurement system, everything starts with COVID-19.
Perfect. Craig, next question. Any other questions?
Okay, yeah, I have got one more question, but before I ask that question, I just want to reiterate to folks that are out there, if you have a question, please use the Q&A window. I know a couple people are using the chat area, and they've sent their questions to CAPPO admin, and I can't see those questions, so please use the Q&A. So the last question that we have at this point in time is, our agency is looking for 3M N95 masks for our local hospital. Does anyone have a recommendations on where to source these?
Jack, may I start with that one?
Yeah, please.
Okay. So I would say if you're an agency, whether you're a county or a city, and you're looking for N95 masks for your hospital, I would suggest if you're not using the Cal OES stock, that's a state operational center, that you tie into that as quickly as possible. They are giving priority to public agencies for support for hospitals. I know we in our county, I'm supporting 4 hospitals, and I am getting my N95 supply currently from the Cal OES stock.
So I'll add to that, Mike, and that's really for every organization. At this point, those supplies, that's where we're getting most of our ridiculous price gouging going on. And even our hospitals that are trying to buy them, we're a decentralized healthcare system down here because I don't have my own hospital. But I heard yesterday that they tried to buy an order and it was seized when it came in from overseas by FEMA. So Mike's advice is right on the mark. Go through Cal OES is your best chance. Otherwise, you're going to be chasing rabbits, as I call it, and they're going to be trying to charge you $7, $8, $9 a mask and want to have you pay in advance. So great transition to the next slide. Protecting against price gouging. Why don't we reverse the order? Why don't we start with Scott and John, and then we'll go to Mike and myself.
Go ahead, Scott.
Order, John, you take.
Okay, thank you. So this is something that's interesting, and again, I want to go back to something I mentioned early on. This is really the opportunity to trust your training, trust those contacts that you have, and again, do not throw caution to the wind and outweigh a quick reaction without vetting the process. Because again, at the end of the day, you want to make sure that if you get that great deal, if you have that product coming in, that when it arrives, it actually meets your expectations. So there's a balancing act, right? For Metropolitan, we received dozens of web EOC requests. So one of the things that we were able to do, again, is reach out to our network. I collaborated with Leticia Woodward, the Assistant Director of Supply Chain for LIDWP, as well as others, to find out who they were using. And then we were also able to capitalize on one of their sources. And knowing that LIDWP, for example, had already received the product, added some credibility. And so that goes a long way in terms of making sure that price gouging is not going on. Again, bring in support. We have all of our buyers going through and working with their current contracts. Again, those suppliers that have already been vetted, and then following up on leads. And one of the things that we've done is we follow our current practice. So where we can move quickly and maybe not use a requisition process, we've used emails to get things in writing, if you will. But we haven't moved away from getting a company's W-9 or making sure that they're a legitimate business. And a lot of that can be done very quickly. And then I guess the last thing that I would say, and it's not so specific to price gouging, is as procurement professionals, be willing to be flexible. You need to expect the unexpected, but work with the different departments, be flexible. And then as I'm seeing some of these bullet points on here, absolutely, if you're finding situations where price gouging is going on, where you have uncovered an unreliable source, let others know so that we don't fall into the same trap.
So let's see, Scott, anything to add there?
Yeah, just that pretty much everything that John said was great. And same for us, we're still following our procedures. I had an example of the police department contacting me to say they wanted to get, I see actually a question submitted about the large quantities of hand sanitizer. And so they had they found a vendor that they wanted to add. It was a new vendor to us. And so one of my first questions was about the price gouging. And Jack, you sent that thing through the CAPPO listserv a week or two ago on price gouging. And I mean, it was literally like, I think the next day was when I had this phone call with the police department. And I sent them that link or whatever it was you gave. I sent that to them and said, hey, just be aware of this. And they actually did their due diligence, and they were comparing it to their normal prices and found it was completely reasonable. So yeah, we're still sticking with getting multiple quotes whenever possible. Again, like I said before, we're trying to stay with the same vendors, but if it is a new vendor, like John said, W-9s, we're still going through all the same steps that we normally do. We're just trying to do it a little quicker than usual, and mostly we're trying to stay with, we have a list, it's called our master open purchase list. And we have this list that's citywide. It's about 300, almost 400 vendors, and that list doubles as our emergency vendor list. We use it throughout the year for regular purchases and normal vendors, but these are like our vetted vendors, so it doubles as our emergency purchases under the federal award guidelines. They're our vetted vendors that we can use, and so we're trying to stick to them as much as possible, which is also helping to streamline.
Right, Mike?
No, I agree with everything. Nothing else that we're doing that's any different.
Good. I'll end this chart with a couple specific examples that kind of got me going to motivate to write that email for the CAPPO list. When the event first started, and I'm thinking back, let's see, it was Friday, March probably 7th. That was a Friday?
Friday the 13th, Jack. It should be easy to remember. It was Friday the 13th.
Okay. We were the Friday before we opened up, so we were a week ahead of that. When I was sitting in the EOC, and about 6 o'clock at night, got this phone call, and this gentleman came in through, what was interesting, through our EOC. So he didn't come through purchasing or anything, and he goes, hey, it was from New Jersey. He goes, I got a guy who got the guy, and how many masks do you want? And I go, well, and we started that conversation, had that little dance. He goes, well, how many million do you want? And I said, well, can you get me 1 million? How fast can you get to it? Oh, I'll get them to you in a week. Okay. Told me about the price. Price was, these were just surgical masks. Of course, they were made in China. And the conversation really went south when I said, okay, I have my U.S. Bank emergency P card. Oh, no, sorry, we don't want to pay the vendor fees or the transaction fees. I said, well, I'll pay that. Okay. Well, no, we need 100% wired before we'll pack the container. Well, that was the end of our conversation. Because I said, there's no way I'm wiring you money. That money will be in the Cayman Islands in about 35 seconds. So that's story number one. Number two was we actually issued a purchase order for some ventilators, 25 grand a pop. They're not the super heavy duty ones for the hospital, but they're portable ventilators. And so $1 million for 40 of them. And we said the payment terms are when they show up in my facility in San Diego, we'll hand you the $1 million check. Well, the guy shows up with 39 of them. Well, we didn't hand him the $1 million check because I would have never seen a refund of 25 grand. So we made him wait 2 hours until we issued a new check. So, and lastly, I'll just say reporting fraud. Our DA has been in contact with me, and I am forwarding on those purchase orders that were offers that were suspicious. So, Craig, you got some questions for us to answer?
Hey, Jack, let me add one more thing there.
Sure.
Kind of something we did too is we reached out and they reached back to us with our local community groups. We had a local group, a Chinese international group, reach out to us and say, hey, we have resources for masks and you guys interested? So they gave us information. We contacted the individual overseas. Come to find out, we weren't able to pay them. So what we did is we went back to the volunteer group, local Chinese group, and said, hey, if you're willing to purchase those or have them send them to you, you be the broker, no markup, no additional cost. You pay for them. Once they arrive, we have them on our dock. We'll pay you for them. and they were willing to do that. They did it, and we got about 100,000 masks doing that.
Wow.
They are actually legitimate masks that we had. We had them send us a sample first, had it checked by our health department, and they verified and passed it.
That's an awesome idea.
One thing that was just brought up that maybe we can share with the group too is in terms of the vetting process, again, logistics and again, communication, collaboration, absolutely get your health and safety group involved. So for example, with Metropolitan, we have a safety and regulatory services section. And every time we had a new supplier or even a current supplier saying we're going to move this product, we made sure we continued to vet that with our safety and regulatory group. Specification sheets were sent through. We documented this typically with email as we were all working remotely. And that adds an element of protection for the agency as well to make sure that the product they're bringing in will meet the expectations. I think especially as many of us are finding there's a difference now between personal protective equipment, say your N95 masks, your P100 type masks, and what is now being used as cloth face covering.
Right.
And so we just want to make sure that as we're moving very quickly, that we're procuring the right type of mask, that it's absolutely been vetted and it meets standards, so that when the product arrives, obviously we're happy with what we have. So.
John, excellent point, and Mike, excellent point about asking for samples. We just yesterday we were fortunate enough to have an RN in our EOC in our medical operations branch that is sort of my partner in the EOC, and we bought some coveralls we actually did a water test with her. We put on the coveralls, and I hit her with about a quart of water, and we have video of that, and it passed the test. So, and I'm not getting fired from hitting her with a quart of water. So, and my boss actually saw it outside the window. Said, what the heck are you guys doing? I said, we're doing a test. So, Craig, you got some questions for us?
Yeah, we've got a couple more questions. The first one, they asked for the Cal OES link. Some of these questions are from the previous slides, by the way. Somebody asked for the link for Cal OES. So I actually put that information in the Q&A section. Okay. So you'll see the link there and some more information about how to access that site. Next question that was posted is, our agency has secured 55-gallon drums of hand sanitizer, but we are 1 to 2 months out for 8-ounce up to 12-ounce plastic bottles. Does anyone have a lead on a manufacturer for plastic bottles and, of course, the caps?
So I'll jump in there. That's what you're going to find. What we have started very early in this emergency. I remember in the EOC, it said, do not throw out your bottles, your old bottles, because all of us had some of those 8 to 12 to 14 size bottles. Because our refill supplies, I think we just got, I don't know, believe it or not, we got 5,000 gallons of sanitizer in one gallon bottles. They don't have the squeeze on it, but then we're refilling our old bottles. So unfortunately, I think those smaller sizes are in the highest demand. Would you guys agree with that?
Email me. This is Mike there. Email me. My email has been put up on the Q&A. We just identified a source today for those bottles because we needed them desperately. We had a local winery, G&J Gallo Winery, converted over to making hand sanitizer. Pretty cool. I'll post a picture later on. But we needed bottles, small bottles to put them in. They gave us some, but we had to go out and purchase some additional ones. So email me, and I'll be glad to share that information.
Yeah, great point, Mike. When we got breweries making real quick, but it does the trick.
Oh yeah.
Yep. That's an interesting point in terms of repurposing and having to vet a supplier. Can you imagine here we are, we've always been taught never use your credit card, your district credit card to purchase alcohol, and now you're using your credit card to purchase hand sanitizer from the local distillery. And that's where communication is key, making sure that you've dotted your I's, crossed your T's. But I agree, Metropolitan has found some of the same sources. I might add to this topic, one of the things that Metropolitan came up with very quickly was a restricted items list. And we did this in collaboration with management and some of the end users to make sure that those items where we found a disruption in the supply chain were immediately put on a restricted list, meaning that the requests had to come through the web EOC tracking process. And with that, we also started working with our customers so that when they asked for 4-ounce bottles or 8-ounce bottles, if we had gallon bottles available, we would ask them, well, you know, this is the same product, will this work for you? Because too often we heard, well, we need Purell. Well, okay, but we've found another product that meets your needs. So this, again, this is a great time in these trying situations to actually build rapport with the various different departments within your agency, especially those that you don't often get a chance to work with hand in hand and come up with solutions. A couple of times we've heard the term, we had to MacGyver this and to get it through. And so it's been productive for Metropolitan, I think hopefully for many of the other agencies as well.
Add, like, yeah, it's
Hey, you guys ready for another question? You guys ready for another question?
Yes.
Okay, next question is, how are you dealing with international suppliers?
Well, for Metropolitan, we're trying to limit the number of new suppliers. And again, so if we were sourcing the product domestically, we continue to look for those sources. Where we have had some product come in internationally, again, we've gone through the typical you know, practices, our normal policies and procedures to make sure we vet those sources. And then in some cases, after you've done that, everything meets, it's still in some cases a leap of faith to make sure that you know, what you've ordered is what you're going to receive. And I would say there too, we've also made sure that we have not extended ourselves in terms of purchasing large quantities or the dollar value is significant. So some precautions.
So I would echo that. We are using our P card, which gives us a certain degree of protection. We actually had one rather large transaction for face shields that we had purchased from an international organization overseas in China. And when the transaction went through, one of the banks, and I think it was Wells Fargo, stopped the transaction because they were worried about the validity of the source on the other side. So really, our U.S. Bank purchase card gives us a degree of, you know, I'm not going to get a W-9 for them, obviously, but in those transactions, using the P card is my degree of separation and protection there.
Another level of protection that we've found with international companies is we've gone through Amazon, used their site to purchase from some of these international companies. We haven't had an issue at all yet. We've actually received our items that we've ordered. Amazon does a really good job of vetting those companies before they're allowed even on their site to sell items or goods. So we've used them as another level of protection, as well as our Cal card, which has a level of protection, but Amazon also provides that, using them as a kind of a go-between.
Good point, Mike. Don't use Craigslist. That's where the fraud is.
Yeah.
Sorry, Craig. Nothing
okay, next
personal.
question. They ask, Yeah, they asked for the panelist email. In the chat, I put Mike's email because Mike, they specifically were asking for yours. But just also let everybody know that emails for all CAPPO members can be obtained by going to the CAPPO website and searching the member database. So next question is, how do we share information about bad actors or bad vendors?
Okay, that is a touchy one, because we have to be appropriately, I mean, I would not want to start posting that at this point. But here's what I would say. If you have a bad actor, I would say notify your local DA or authorities. And then, I don't know, Mike, do you have any thoughts on that?
Well, we've been keeping our own internal kind of list. We haven't shared it publicly because you got to be careful. There may have been just an issue with you and them on one order. So you got to be very careful of identifying a list publicly of vendors that may or may not be performing.
Yeah, and I like that comment. We reported it to the DA, and I will call my close colleagues in this general region and just give them a heads up, and you know, they'll do the same with me. Any other thoughts, John?
No, I concur. That's the same thing that we do.
Pat, you good?
Thank you.
Okay.
Okay,
Great.
next question. And I think we kind of touched on this a little bit already, but if there's anything you want to add to it. The question is, how do you recommend we deal with vendors that are requesting payment for goods before they will provide you with a lead time?
You know, what we do is we say, look, you know, and then we have had people that say, well, we won't give you a delivery date until we give you a PO. So, okay, we'll issue a PO that's subject to an acceptable delivery date. So I give myself that if I don't get an acceptable, I'm not going to give you a PO that's going to say, well, I'm going to deliver next October. Okay, so we kind of have to do this dance. But someone mentioned the ability, the flexibility. You know, normally people would be willing to give you a commitment date before you issue the PO. But if they want to play that game, I'll just say this PO is subject to our agreement to your proposed delivery date, or I'm going to cancel it. Any other thoughts on that, guys?
Yeah, we would definitely spend some time with that vendor and ask some leading questions, really try and dig deep to see if this is a legitimate purchase and if we feel comfortable moving forward. I think there have been times where we've actually decided not to move forward on a purchase. Even, I'm sure we've all heard this. If it sounds too good to be true, it might not be. And so there's been times where we've decided to move in another direction and shied away from suppliers like that. In situations where we thought it was legitimate, again, some of the protections that have already been discussed, maybe we put it on the credit card and look for protections there, or we use a third party like Amazon, or in some cases, we'll contact our local distribution supplier and say, are you familiar with this company? Would you be willing to bring this into your channel? So fortunately, we haven't run into too much of that so far.
Okay. So Craig, any more questions for that first section? First couple.
Sorry, my dog is barking at the mailman here. Yeah, there's one last question is, would it be possible to share a master list to call for references if we know this vendor has provided another agency as a reference?
I see no problem providing references to each other. Do you guys agree?
I agree.
Yep, I agree.
So several times I've asked, who else have you sold it to? And like that one guy that was trying to have me make prepayment, he did give me some references back east. And the next morning we called him, called those references, and the purchasing officer said, we no longer do business with that company. That was all I needed to hear. So, okay. Craig, we'll move on to the next one, public interest. Portable restrooms for the community. Yeah, I'll start with this one. If you're familiar where Borrego Springs is, out in my desert, out towards Palm Springs. So about just a few weeks into this crisis, we're putting portable washrooms and hand stations out there in the community to keep people safe. But I had to put 4 restrooms out in Borrego Springs, and I'm like, do more than 4 people live out there? But the point was, people are cabin fever, and where do they go? They go out to the desert. So, who would have thought we needed that many portable restrooms? And literally, for us to service those, there's not companies out there. So it's a 2-hour round trip to get them out there and to get them serviced. And we're getting them serviced daily because they actually have a porta potty patrol that looks at them every day to make sure that they're clean. Anyway.
Yeah, I would agree. The portable restrooms is a tough issue. We had every city in Monterey County calling us for the need for portable restrooms, portable showers in their homeless encampment areas. So what we did is before we provided anybody with anything, we brought in the Homeless Coalition leadership, sat down with logistics, and we discussed the areas of concern on where they would need these items, how they would be protected and serviced. And so once we got that plan of where they would be placed, how many, how they would be protected and serviced, we put a request into Cal OES, and we were able to actually get everything that we needed through Cal OES in place. And our biggest one is in the city of Monterey at Jack's Park, or Elistero Lake, excuse me, which is a big one, which has been very successful, got some good feedback from the press and the local community, because now we provided the homeless group with facilities to utilize and not their front yards. So
right.
I would suggest bringing in your Coalition for Homeless and have that discussion.
Contracting for hotel rooms. Key thing we've done here, we were very, I'll call it ahead of the curve with doing this. I remember that my first night in the EOC, our CAO said to me, Jack, I need you to contract for 200 rooms. So I left the EOC for 200 rooms for 30 days. I left the EOC, we had contracted for 227. The next morning I came in and he said, I need 3,000. And so we got him to 1,800 pretty quickly. And we're standing pat about 2,000 rooms right now, but with the new FEMA guidance, we are only paying for rooms that are occupied now. So I've rolled them off of the first 30 days. I went through a period where we had contracted for the whole hotel. And because I didn't know what my demand was going to be. And right now I think I have about 400 rooms that are occupied. So, but we're only paying for the rooms that are occupied at this point. Does anybody else have any different experiences there?
No, but Jack, we're going to hold you to that when it's your time for your CAPPO conference.
I would just say too, Jack, in agreement with you, be careful about booking hotel rooms or lodging facilities. As you said, FEMA will only reimburse for those that are occupied.
That's correct.
Occupied rooms.
And there's a little nuance too. It can't be for a homeless room. It has to be a COVID
positive.
Or a COVID, you're protecting a population, or it's COVID related. So there's a little bit of wiggle room there, but you got to be cognizant of that. Good point, Mike.
Can I share with the group? So for Metropolitan, given our business objectives, I looked at public interest in a little bit of a different light. And I looked at what would Metropolitan do to protect the public interest with regard to our operation. So a couple of things I wanted to share was where we were coming into situations, again, related to trying to get our name on the list, if you will. Obviously, this type of emergency was specific to a number of items in our supply chain. We developed a letter that fell in line with, the letters that you're seeing that come out in terms of critical essential businesses. But we took it a step further to say that, these are operational continuity business operations. And we had this letter ready in case we felt as though we needed to place Metropolitan in line. And I share this in terms of the public interest to say that we were very much aware of not wanting to take supplies from the medical field or the first responders. And so in terms of public interest, where we could, we would try to work directly with manufacturers. I think there was a question earlier about working with 3M. We were able to partner directly with 3M, and I'd be happy to share that contact. And again, in addition to that, we developed an inventory action plan, or allocation plan, I should say, that was specific to this event. So we were limiting the number of items that we would then look for reimbursement from FEMA, and also in terms of trying to bring in those supplies for the district. And partnered with that was this restricted item list. So again, should we be asked as to how we were, monitoring our business with regard to, the public interest as a whole, we were very specific as to what was a functional need for Metropolitan to continue to provide water. So again, I kind of took that at a different angle.
Yeah, makes sense. That makes sense. Okay, we only have a few short minutes left, and I know there's, Craig, do you have any other burning questions before we get to the last slide?
Yeah, we've got a couple questions here, not regarding this current topic, but I think this is a good question. And the question is, some FEMA training advised against using credit cards for COVID-19 purchases because credit card purchases would not contain the necessary T's and C's. What are your thoughts?
I guess I'd like to see that guidance. We have not, the T's, we do have for our larger, so when we're using purchase cards, it's for commodities, and it's for, we're paying against maybe a blanket purchase order. For example, the hotels that we put in place. We will use the P card as a payment vehicle rather than cut a check. But so those contracts do have the required, those contract agreements, those BPAs have the required flow down clauses from FEMA.
Yeah, I would agree that if you're purchasing services, you're going to want some type of supporting documentation with T's and C's. Right. When it comes to just the goods and using your CAL card or your procurement card, there's no requirement really for the T's and C's except what's in your credit card agreement.
So we've actually
looking for services.
Yeah, we've added those same FEMA clauses to our purchase order as well. The backside of the or as an attachment to the purchase order. So good question, though. Really good.
Okay. And another question is, are any agencies partnering or teaming up for bulk purchases for items that are well beyond the amounts needed by a single organization? As a small agency, it would be valuable to share of a larger organization's usage.
We are in Monterey County. We're partnering with our local cities, special districts that are small, that need items but can't do the large purchases that most of these larger providers are requiring, 100,000 N95 masks or 500,000 shields. And we are partnering with them as well as our local hospitals. The most recent one, though, that we're partnering with is our ag industry. There's a coalition of ag professionals that have come together that we're now a part of as logistics. Because we have our harvest season starting, we have over 50,000 farm workers coming in to the county within the next 30 days.
Yeah, I would just say my advice would be is that as an entity, you plug into your county EOC. That's how you're going to be able to get those partnerships going, because I'll call them, they're in the hierarchy of allocations within, from the feds to the state, to the counties, to the cities, to the first responders, to the healthcare organizations. So let's move on to the last chart, if we can. Sustainability. You know, I'll start with my organization. The things that we have bought, we're now starting to look out. Okay, what is 60 to 90 days? The supplies. You saw the past couple on these charts. Sheila, thank you for adding some of those pictures. Were from my conference room. Has become a mini supply warehouse, not as big as the one you have, Mike. but since nobody's here, that's my conference room now, and I get supplies daily from Waxy. They've been a great partner, and it's really going to be. I'm going to start thinking about things a little bit differently since I don't have a warehouse anymore. I need to strategically partner with. I mean, literally, Waxy's warehouse is 1 block away from me, and beyond this, I'm going to look to pre-position my emergency inventory at that location because they have a fleet of trucks that can get to the far reaches of my county. So that I'm going to be looking 90 days out and beyond. I think we're in a new normal of we're going to. I mean, God forbid if it was fire season and we started talking about, okay, we had this, but God help us if we had an earthquake or a fire on top of this. How would we handle multiple emergencies? So, anybody else? Some thoughts?
And you know, Jeff, that's a good point. And that's something that we did a week ago in our EOC. Was we looked at, okay, we're coming up on potential fire season shortly, and if we had an earthquake, so we have put into place multiple plans for those different incidents if they were to happen and how we would respond. Setting up 3 separate, potentially EOCs to handle each incident separately.
Yeah.
For Metropolitan, one of the things that we've started doing early on was working with, again, throughout the EOC, but working with human resources, working with the different groups to start sending information to our employees. What will this look like as there's a return to what we're calling the new normal? How will we be returning to work? Our general manager held a town hall for everyone over, I don't know if they use Zoom or whatever they use, but to provide information, again, because we have 800 employees that are now working remotely. And then in terms of our emergency challenges, again, I can't say it enough, begin looking at your processes, begin looking at your FEMA requirements, even while this is ongoing. And then what would that look like 90 days from now? We're starting to look in terms of bringing in additional product into winter, to see what would that look like. And then also with regard to what were those, I guess, projects that we knew were absolutely had to continue to move forward, and what were those things that we were able to put on the back burner. And so there's also an ongoing assessment there to make sure we're prepared and what that might look like should this occur again.
That's an organizational risk assessment. That would be a good tool or document. Okay, Craig, we're going to turn it over to you for some final wrap-up questions.
Okay, we just have one final question. What if the quote says no cancellation? Is the recommendation to not move forward?
I would say depends on what it is, and whether or not I've already seen a sample. But I'm not going to buy something sight unseen with no cancellation. Any other thoughts?
I agree. It depends on the circumstances, but I mean, I would think that would be a very rare, hopefully a very rare situation where, we absolutely would need this item. There's only one supplier out there. So again, I think that's going to be on a case by case, but typically we wouldn't move forward with something like that unless we've vetted it appropriately.
Okay. Well, thank you, everybody. Hopefully, looks like we had 150 some people online. Hopefully this was helpful for you. I want to again thank Craig, first of all, for being our moderator. Well done. Thank your puppy too. He helped. And Sheila for being our back office. We appreciate the CAPPO home office, and our panelists, Mike, Scott, and John. Thanks for sharing your time and insight with us. And I know Jennifer couldn't be with us that long, but I'll be sure to thank her as well. So keep on doing great things out there, CAPPO. I mean, this is the time for us to shine. So have a great day, everyone.
Thank you, John.
Thank you.